Hi, good afternoon or good morning to everyone, and welcome back to our afternoon plenary session. I am more than thrilled to introduce this next speaker. We're honored to have Mr. Jim McCray join us today. Mr. McCray is the Associate Administrator with the Bureau of Primary Health Care in the Health Resources and Services Administration of the U.S. Department of Health and Human Services. Mr. McCray has led the Health Resources and Services Administration, also known as HRSA, their Bureau of Primary Health Care, for more than 15 years. As head of this bureau, Mr. McCray manages $5.7 billion budget that supports nearly 1,400 health centers, which operate approximately 14,000 service delivery sites in every U.S. state, D.C., Puerto Rico, the U.S. Virgin Islands, and the Pacific Basin. Prior to his years with the Bureau, Mr. McCray served as Associate Administrator for HRSA's Office of Performance Review from 2000 to 2006, where he oversaw the work of staff and regional divisions across the country. He also served in several capacities at the Bureau from 1992 to 2000. As the Bureau's Director of Office and State and National Partnerships, he worked with national and state associations across the country to increase access, reduce disparities in health outcomes, and improve the delivery of health services to underserved populations. Mr. McCray has received numerous awards, including the Secretary's Award for Distinguished Service, the Hubert H. Humphrey Award for Service to America, the HRSA Administrator's Award for Equal Opportunity Achievement, and the Presidential Meritorious Executive Rank Award. And we're going to add to that list today as we're giving Mr. McCray a School-Based Healthcare Champion Award for his tireless support and commitment to our field. So please join me in welcoming Mr. Jim McCray. All right, Jim, you're on.
Great. Thank you so much, Andrea. It's great to be here today. And as Andrea said, good morning and to those out on the West Coast, and of course, good afternoon to those in the Midwest and the East Coast. It's such a great pleasure to be here with you today. I really appreciate all the amazing work that the National School-Based Alliance team has done. They have been incredible champions and supporters of the work that you all do. And it really is because of the work that I know you all do every day, and I've seen it firsthand with all of the work that's happened, especially with COVID, but even prior to that, the amazing work and accomplishments that you've been able to achieve. And I know it has not been easy. We have definitely heard that from our health centers. We've heard that from our school-based sites. And actually, I've heard from many of you the challenges that you've seen, most recently with violence that's happening in our schools and in our communities. And you all really are on the front lines of providing that kind of support. You've been absolutely instrumental in COVID-19 response. And your work is being more and more recognized across the administration, across the government, across the country, with what the impact you've been able to make. And so I can't thank you all enough for what you do to assure access to primary healthcare services in this country. So just a big thank you before I begin. If we can, let's go to the next slide. So what I wanted to do in my presentation was just share some of the priorities that we have here in the Bureau of Primary Healthcare. And as you know, we support a number of school-based health center sites through the Bureau of Primary Healthcare. But then I did want to talk about some larger issues that we see impacting on school-based health centers across the country. And then most importantly, I know, what does the future look like? So with that in mind, I'm going to jump first right into our strategic priorities. So one of the things that we've seen, especially with respect to the pandemic, is the critical need to go into underserved communities and to serve the most vulnerable in this country. And really the way we look at it is how can we improve health outcomes, reduce health disparities, and advance health equities for the populations that we serve. We have identified 3 key priorities for us in the Bureau of Primary Healthcare in terms of accomplishing that mission. The first is how can we strengthen and further strengthen our health centers and our school-based sites to deliver care, and really how to prepare for the evolving and ever-changing healthcare environment. The second is how can we activate and accelerate evidence-based and innovative approaches to care. And then finally, how can we continue to reach out to the neediest communities where they don't have the benefit of a school-based health center site or a community health center. So with respect to the first one, if we can just go back just for a minute, I just wanted to touch on each of these quickly. So with respect to strengthening the health centers, the key for us really is around supporting the workforce. The workforce was strained significantly prior to the pandemic, and the pandemic has definitely put a spotlight on it. We also know that the workforce is the most important part of school-based health centers, as well as health centers in general. One of the things that we're going to be doing over the next year is to do a overall workforce well-being survey to help identify what are some of the challenges that health centers have, school-based health centers have, and what are some of the things that you need from us in terms of supporting your work. We also have been working on an initiative to further strengthen our health centers. We call it Advancing Health Center Excellence, where it's really looking at all the different components of what it takes to make a strong health center, a school-based health center, a strong governing board, a strong management team, strong financial systems, strong clinical systems. And then what many of you have told me is really that connection within the community and how can we better support that. We also are looking at how we can learn from COVID-19. There were a lot of things that worked extremely well, but there were also many things that we know we could do better. And one of the things, and we'll talk about it a little bit later, is really how can we build on some of the things that you all did incredibly creatively to address COVID-19. So that includes pivoting towards virtual care in schools. How did you continue to provide preventive services to your patients? And really, one of the things we saw the most of is that increase in behavioral health services. And then finally, how do we better engage with you in terms of our work? The other big piece that we're doing around priority 2 is we're going to be introducing patient level data to all of our health centers. One of the things that we found is that while we had a good sort of picture of the patients and populations that were coming into our health centers, we really didn't understand all the interconnections between income, insurance, patient outcomes, and really wanted to dive deeper into that. And so we're going to be asking our health centers to provide patient level data so that we can work on more tailored interventions to really meet the needs of our populations. We also are pushing the whole idea of value-based care to move in a direction where we set what the model of care should look like and then have reimbursement follow. And far too often, as you know, reimbursement tends to drive how care is delivered. And we really want to move away from that. And then finally, you're going to hear more of me talking about how we can promote greater innovation. And then lastly, in that last category is how do we continue to support the expansion of the services that are provided in our centers to include not just medical care, but oral health, mental health, substance use disorder services, and some of those key enabling services that are so critically important. Let's go to the next slide. One of the other things that we saw during COVID-19, but really has been a hallmark of what you all do and really what health centers do across the country, is going out into the community and meeting people where they are. Health centers have never been constrained by their four walls. They're continually looking for how can they reach out. And one of the key areas, of course, is in our school-based health centers. We have seen a significant increase in the interest in school-based health centers, more than I've ever seen in my entire career. And that was even happening before the resources became available. And so we want to continue to support that type of effort to encourage more school-based sites, encourage more school-based health centers, and really figure out how we can build more partnerships within the community to do more for our patients and our populations. The other thing that we found to be incredibly helpful, again, during COVID-19, but even prior, was the use of mobile sites. And I know many of you have sites that you utilize to go to schools, to do everything from physicals to all the way to basic primary healthcare services. So one of the things we're also looking at is how we can better support mobile clinics in terms of the work that we do. And then finally, as I mentioned, that real pivot towards virtual care. One of the things we're working with all of our health centers is to figure out what is that right ultimate balance between doing in-person and virtual care, and really what makes the most sense in a school-based setting. Because that can be challenging, but what can be the most helpful. We saw the biggest increase in behavioral health services and the use of virtual care. We want to figure out what does that look like going forward. Can we go to the next slide? Can we hop to the next slide? Oh, there we go. Perfect. So health centers, children and youth, and schools, like I said, has been just a critical part of everything that we've done. Right now, our health centers across the country are serving about 1 in 9 children and youth in the United States. We have provided over 1 million vaccines to children under 17, and I'll talk more about some of the new opportunities that we have. And we have almost 40% of our health centers are operating 1 or more school-based health center sites. Like I said, we've seen a dramatic increase in that over the last several years. And while we did see a slight dip in the number of students that were served last year, this was in 2020, we anticipate that that's going to increase in 2021 and increase even more in 2022. Overall, we have about 3,200 school-based sites that are supported by our community health center program. And as I mentioned, we saw, and thank you to many of you, we saw just a huge increase in vaccination clinics that were happening as a result of COVID-19. In fact, a little over 10,000 clinics days were implemented in our health centers. Can we go to the next slide? So one of the big things, while it may not have a direct impact on many of you, just given the age population, we know that this is still a huge issue. We just received approval about 2 weeks ago to begin vaccination efforts for children from 6 months to 5 years. And one of the things that I will tell you in the Biden administration that's been, I think, a true recognition of the value of the work that you all do was that very early on, they recognized when vaccines were rolling out, and I'm going to go back just for a minute to February of 2021. You may recall there was a huge effort to do mass vaccination clinics to get as many people vaccinated as possible. But at the same time, the Biden administration recognized the critical need for going to where people were and reaching those populations that may not be best served by a mass vaccination clinic. So they actually reached out to us, to the community health center program, utilizing our school-based health center sites, to go into our migrant clinics, to go into our healthcare for the homeless sites, to really reach people where they were, to make sure that everybody was vaccinated. And it was with a whole focus around health equity. And that continues today. In fact, a big part of the whole rollout around 6 months to 5 years is going out to our health centers to make sure that they have vaccine so that they can get people vaccinated. And as you know better than anyone else, a lot of this effort is going to require working with parents, working with providers to really share concerns and to work through any issues that parents may have to get them comfortable with getting the vaccine. And one of the things that makes me the most heartened, and I see it every 2 weeks from our data that we collect, is that while you've seen a plateauing of vaccines in terms of new vaccines or even boosters, we continue to see an uptick in our health centers. And I think it really is because of that connection that they have with the parents, with the communities, to share that this is going to make a difference. This is actually going to reduce hospitalizations, reduce deaths, and actually make your children safer and provide effective care. And as I've heard many health centers say to me, it may not happen the first time, it may not happen the second time, it may not even happen until the sixth time, but it's that opportunity to engage with a trusted provider or with a trusted community member that really makes the difference. So again, we've seen that over and over again with the work that you all have done. And as you saw, we've now vaccinated a little over 1 million children through the health center program. Let's go to the next slide. So one of the other big pieces, of course, that we're working on is boosters for kids. And so the other thing is just getting children vaccinated, especially from 5 to 11. So this slide really talks about the critical importance of vaccinating children from 5 to 11 years old. And you can see that, while it's rare, it still happens. And having that vaccine makes a huge difference in terms of people's ability to not have to require ICU care, to not have any issues with respect to hospitalizations and even deaths. And there are a number of different articles that talk about that, and just would encourage you to continue your efforts. And I know sometimes it's not easy, but just to continue your efforts to work with your parents, work with the kids to get them vaccinated. Can we go to the next slide? As I mentioned, the boosters were just recently approved. There was a media statement that came out. And so this is another part of our effort. So it's, of course, getting those initial vaccinations, but it's also getting those boosters. And again, we see how important that is to get children and kids and adults, of course, to get vaccinated. And there are a number of different resources that you can link to. You can see the HHS We Can Do This and the VSafe, the after vaccination health checker. So just encourage you all to continue that work on vaccinations. Okay, if we can go to the next slide. So another key piece of our work, and I did mention this earlier, is the whole pivot towards behavioral health access. We've seen it both with respect to mental health as well as substance use disorder services. The biggest shift that we saw was really the movement towards telehealth and behavioral health. So prior to the pandemic, less than 0.5% of our visits were done virtually. As you can see on the mental health side, it was over half. And what we've heard from a lot of our patients is that that continues to be a preferred method. It reduces stigma. It makes people, in a lot of cases, much more comfortable to be able to access care. We've also seen it in school-based settings that, sometimes they just may or may not feel comfortable coming into the school-based clinic, but being able to talk to someone, whether that's at home, after hours, to be able to have those visits just makes a huge difference. The other thing that we've seen is just an overall increase in terms of the demand. So overall, we saw a slight decrease in the number of visits, but mental health went up by, as you can see, almost 15%. And the number of providers that we were able to add as part of the American Rescue Plan was almost 7%. So that's definitely an area that we continue to see and be critically important. Go to the next slide. So we also, of course, are working on just overall what we can do to support depression screening in children and in adults. We're looking at what we can do around MAT. We're looking at just tele-behavioral health services. And this continues to be a focus for us. And one of the things that we've seen overall is, and we've heard this again from many of you and from our health centers, is that really focusing on the preventive side of behavioral health services is so critically important. So of course, treating anxiety, depression, other mental health conditions is important, but it's also so critically important given all that's happening in our universe and in our world today, is to help people with developing mental health skills and abilities to be able to address certain issues or work through certain issues and really build that mental health that we see in our kids that's so desperately needed. In fact, you'll see it in one of the budget proposals that we have about child development services. But behavioral health is just so critically important to the work that you all do. It's so critically to the work that we hear from our health centers. In fact, it's the number one need that our health centers say that they need to have addressed and would like additional resources. We go to the next slide. So you can just see again the growth in terms of health centers providing mental health services as well as substance use disorders. So we were a little less than 450 in 2019. It jumped to almost 1,300 in 2020. We're anticipating the same kind of statistics for 2021. Same thing with substance use disorder services. And it's just going to be a new way of us working going forward. We'll go to the next slide. So now that was a little bit of an overview of the health center program and where we are. What I really wanted to focus on now was more where are we headed as an agency, where are we headed as a department, and really some of our great partnerships that we've developed. So one of the first things I hope you all have seen already was the letter that we sent out from the Department of Health and Human Services and the Department of Education. And this is part of a departmental, and not a departmental, it's a part of an administration-wide effort to increase the capacity of schools to be able to provide school-based health center services, whether that's through a health center, a health department, a hospital, or a school itself. And one of the things that we've been really working on together is a greater level of collaboration between our two departments, because we know while most of the action happens where you all are, if there are barriers that we create from where we sit that make it harder for you all to work together at the local level, that's not helpful. So we've been looking a lot at what can be done to improve that relationship and, most importantly, reduce those barriers. We've also been working on a number of different resources to help support you. And so I hope you saw that in our guide, that we were able to provide a number of different resources that you all can utilize. You can go to the next slide. The other big piece that we did, and really a huge, again, shout out to the School-Based Health Alliance for all their help. We did a webinar together. It was co-hosted between the U.S. Department of Education and HHS, and this was done in late March. And what we wanted to do was highlight some successful partnerships, because one of the things that we heard, especially from the school district and the education side, is that they don't always understand how best to develop partnerships with health centers. Schools honestly have shared with us that often the billing practices that are associated with Medicaid and other private insurance is very difficult. And what we have seen is if relationships can be developed between school-based health center sites, health centers, and schools, it can really create a synergistic relationship where services are provided, of course, to the kids, but there's also an opportunity for the family, the larger family, to have access to services. And one of the things that's really important that we've seen is that there are dedicated leaders on the health side and dedicated leaders on the education side that are committed to working together and working through any issues. So just a huge thank you to the School-Based Health Alliance. It was a great session. If you haven't seen it, I think you can, if you click on the link down below, you can see an archived version of that. In addition, we've held a couple of virtual workshops with the National Association of Community Health Centers to really talk about how health centers can do more in the school-based setting, and then even how do we support non-330 health centers in terms of our work. All right, let's go to the next slide. And I know this is probably the thing that a lot of people are interested in terms of resources. So we were so very excited that in 2021, we received our first amount of money that was dedicated solely to opening new school-based sites in our community health centers. It was the first time we'd ever received money that was specifically targeted to go into schools. And granted, it wasn't a lot. The first year was about $5 million, but we received well over 300 applications. And so even though we were only able to fund about 27, it demonstrated the demand. And as a result, in 2022, we received an additional 25 million to support a total now of 152 school-based health center sites. And we are just so excited by the collaboration that we've seen among schools and the health centers in terms of these programs, and are really looking forward, most importantly, to seeing the outcomes of these results. In addition, and I think you all may have seen it, there is a new House mark that came out that includes additional resources in 2023 to support both community health centers, school-based sites, as well as non-330 school-based health centers. So we're really excited about that. We are working on guidances for both of those. You know, of course, the Senate has to weigh in and then the president has to sign off. But in case any of that does happen, we are getting ourselves prepared. And again, you know, receiving your feedback about what those different funding opportunities should look like. How do we support both 330 health centers, health center program funded health centers, as well as non-330 health centers? Your feedback and input has been incredibly helpful with that. The other piece, which you can just see here, is in terms of the revenues itself. Just overall, not surprising, probably similar to several of you in terms of your operations about how you're supported. We can go to the next slide. With respect to the president's budget, I did mention this a little bit earlier. So we are continuing our efforts to hopefully eventually double the program, the community health center program. You can see at the very bottom that the administration indicates that it looks forward to working with Congress to actually double the investment in community health centers. We definitely see school-based health center sites as a key piece of that in terms of increasing that footprint. And we are continuing to answer questions, whether it's from the House or the Senate, on potential expansion of the program. In addition, the president's budget included money to continue our Ending HIV project initiative. We have supported to date about 350 health centers. We're hoping to add another 40 or so to get up to 400 health centers on that effort. And then, as I mentioned earlier, we are going to be working on a new early childhood screening and development program in our health centers. And it's really to help make sure that children are meeting some developmental milestones and addressing any questions that parents may have, and really, most importantly, help connect parents to additional resources and services that they may need. Because we all know the importance of critical and early childhood screening and development services. Because if you don't start off, well, you can get behind very quickly. And so we're really excited about the recognition of, number one, this service, and then how health centers can play a key role in that. We can go to the next slide. This is something, I don't think your conference is continuing till tomorrow, so hopefully I won't step on what you all are doing, but we are having a webinar tomorrow, June 29th at 3 p.m. And it's for a new prize challenge. This is something new for us in the Bureau of Primary Healthcare, and we're calling it Building Bridges to Better Health, a Primary Healthcare Challenge. And what this is about is, for lack of a better word, it's like a Shark Tank competition where we want as many applications to come in. It's really simple, no greater than 5 pages. It's not bureaucratic. It's really, what's your best idea? And in this case, it's about how to make stronger connections between the medical community and social services, and how can that be done in ways that support a variety of different populations. And that can absolutely include school-based patients and kids. And so what we're really looking at is and looking for innovative proposals. It is not limited to health centers at all. In fact, we're encouraging technology companies, social service organizations, schools, other people to come in for this competition. And it's really an opportunity for you all to share your best ideas and participate in this challenge. Ultimately, we will go through 3 rounds and then declare, quote unquote, a winner. But what we hope to do in each phase is to support groups of people to work on their projects. And what we hope is really move the field forward. If you're interested in any more details about this, please go to challenge.gov. And if you can, please join us for our webinar tomorrow at 3 o'clock. All right, let's go to our last couple of slides. So the last thing I will just share is that, and you can see this hopefully on your screen. My screen's a little bit small, but this is a picture of our administrator, Carol Johnson, and she was visiting one of our community health centers as part of the announcement on our school-based health center sites. And she got to see firsthand the work that you all do. And I will just share, was incredibly impressed and came back and asked, like, what else can we do to support these school-based health centers? What other things are important for us to be thinking about as we proceed forward? And really a recognition of the importance of having healthcare services in the school to deliver those services that kids need, where they need it, when they need it, because of the impact that it has on their health, of course, but the impact that it has on their learning. And so she challenged us. The health center actually came back and gave us a lot of suggestions about things that we can do. And I hope in our Q&A section, we have the opportunity to have more of that kind of dialogue and discussion too. Because at the end of the day, what we want to see and what we want to experience is, what can we do to better support you and the great work that you're doing? We can go to, I think, to the last slide before we get to questions. So I think it's just more pictures. So you can see this particular school-based health clinic actually had a mobile van. They had a ton of resources coming in. They were supporting everything from testing on COVID to mass distribution. And again, a recognition of the critical role that schools play in health was definitely prevalent and was well expressed by the participants in this session. So again, just a huge thank you and shout out for everything that you all have been doing. I can't thank you all enough. We'll see what happens with respect to our funding going forward. I know that's what a lot of people are very interested in. But I will tell you from where I sit, both from the Congress side, from the administration side, I've never seen more of a recognition and appreciation and a commitment to do more in school-based health in my career. And as Andrea said at the beginning, it's been fairly long. So I'm really excited about this. I personally believe in this. My wife worked in a school system for a long time, just retired recently, and talked about just the critical importance of the school-based health professionals and that connection between teachers and providers and really working with kids in improving their health and improving their learning. So again, a huge thank you for everything that you're doing. And I think at this point, I will turn it over for some Q&A. So Andrea, I'll turn it back to you.
Great. Thank you so much, Jim. We're going to add to your resume mind reader, because I think you just answered 3/4 of the questions that came in through the Q&A. So that was great. Thank you. A lot of them were around the funding, as you predicted. So I will turn to a few of those. And first, we do have a question about community health workers. So the question here is that states are developing and implementing community health worker approved curricula, specialty training curricula, licensure, and certification. Will this role require credentialing, and will the services provided by them be reimbursable by Medicaid, Medicare, and commercial insurance plans? If not, how could these be paid for and sustained? And do you see a federal role for this?
So it's a great question. And honestly, it's going to be a little bit mixed depending on the state. We've seen some states that are working towards licensure for community health workers. We see others that are not moving in that direction quite as much. I hope you all may have seen a recent, and it's a sister bureau in our agency, the Bureau of Health Workforce, actually came out with a community health worker funding opportunity. The intent behind that is to actually support up to 75 grantees and to support the actual training, licensure, and certification of up to 13,000 CHWs going forward. So really excited about that. And the intent behind that, Andrea, and for all the participants, is really to build momentum and demonstrate the importance of what needs to go into licensing, what needs to go into credentialing, and most importantly, what needs to happen with respect to long-term funding. One of the things that we've done in our health center program, and again, it was because of the feedback that we received, is that when we did previous funding opportunities, and I'll just talk about the most recent ones that we've done, both in ending HIV, but even more importantly in behavioral health, we initially focused on the clinical staff. Not that it was wrong. I mean, we focused on supporting psychologists, psychiatrists, social workers. But after our first round of that, what many of the health centers said is, that's not enough. You need to allow us to support the community health worker, the patient support staff, the patient educator staff, because we can only do so much in a clinical setting. We really need those folks to help bring people back into care, to do the follow-up, to make sure that they have the services. And so whenever we have the opportunity now, we're trying from where we sit with our grant dollars to say, this is absolutely something that you should support. In fact, for me, it's a priority in terms of supporting community health workers with our grants. But I think we're going to see over time more and more certifications, licensure, but I think we're also going to see more on the reimbursement side. But it's going to take a little bit of time, and it's probably going to be a little uneven as we go forward.
Great. Thanks, Jim. Another question that came into the chat says, considering school-based health centers to be in compliance with the good faith requirement without having to provide estimates would be a huge reduction in administrative burden. Where are you with that decision?
So we're still looking at it. I mean, this is one of those issues that you've got to work with the lawyers through in terms of like what you can do and what you can't do. So we're looking at it. We've heard loud and clear from you all about, the burden that it can create. So we're trying to figure out creative ways to try to address the requirement, but without creating such a burden. So we are open to suggestions if folks have ideas in that space. So, but we've heard you. So.
Great, thank you. One here is actually how we could support you all. This question says, our leadership in Congress is much more supportive of school-based health centers. Moving our state leadership forward has been painstaking. Any information you consider most essential to share with legislators to garner state support for school-based health centers in health centers?
The most, two things I would say. Number one is whatever stories that you can share with us. So you may see it like on our website, we have something that now, it started with COVID and we've just continued it, which is what we call health center stories. And what we try to do literally every week is to have a new story, and it can be on any particular topic. And so we actually have been looking for some good school-based examples. So if you have some good examples, that's incredibly helpful to us. At the end of the day, the most important piece, though, is the data to show the impact of the funding and what's that meant. And I think, especially in a school-based setting, it's not just the health of the students, but it's actually what it's meant with respect to their not missing as many days of school, learning, all those kinds of things. And it can be done at a patient level or it can be done at a school level. And I know we've been sharing a lot of that back and forth, Andrea, in terms of the data and information that you all have. But that is just so critically important because there's so many priorities, especially for us on the Hill, and I'm sure at the state level. But wherever you can, just talk about, how this has improved health, how it's improved access, but how it's also improved outcomes for the patients and created savings. And in this case, I would say the savings is, less school time lost. So whatever we can do together to make that argument, I think is important. And then the only other thing I will just say from the health center side specifically is just what we've been touting is just the demand for this. And so, when we had our last competition, there was real concern, like, would we get 100 applications? We got over 300. So if we have another competition, would just encourage a lot of people to come in. So that always helps make the argument about the demand and need for the service.
Great. I see that coming in the chat box that we definitely have stories from the field. So we will, but that's a great idea to share it back through. I mean, we collect some with the Alliance, and I love that idea of circling back.
What I have found in, again, my years of experience is data is great, but to have a couple of stories that then back it up is just if you can do those two pieces, it makes such a difference.
Absolutely. One other question came in asking how should or how do health centers address when you were talking a lot about telehealth, how are health centers addressing language needs through the telehealth model?
Yeah, it's definitely been a challenge. We've seen health centers address it in a variety of different ways. Some of them have, literally worked with some of the people out there to do language translation on the screen, which is not ideal. Many of them, however, have actually hired individuals that speak in the different languages, either providers or, potential interpreters to be able to be available. It is not easy. And I think that's part of what we're trying to determine going forward makes the most sense. You all may have seen that we just recently, I think it was about 4 or 5 months ago, awarded grants to about 25 health centers to look at how to optimize virtual care going forward. And the whole idea behind that was, we did this huge push, of course, to pivot, less than 2 weeks from going pretty much all in person to all virtual. But what we have done is basically supported these 27 or so health centers to say, what does it look like going forward? And I think most importantly, what we've challenged those health centers to do is not only figure out what's the right balance, but how do we do it in a way that assures health equity to make sure that we don't leave certain populations behind. So we've talked about how do we make sure that it's accessible to racial and ethnic minorities? How do we make sure it's accessible to people with limited English proficiency? How do we make sure that insured and uninsured individuals still have access to it? So that's part of what we've been trying to figure out, is how do we do that in best way. So I think, if I'm remembering right, I think it's 1 or 2 of the health centers focus specifically on language access and how best to do that. So.
Great. Thank you so much. I think those are all of the questions that have come in for you. And we have lots of people thanking you and for the federal support from the Bureau, and lots of people saying we have stories to share. So I do greatly, greatly appreciate your time today, Jim. Thank you so much. Your support really is very valuable, and you continue to be an amazing partner. Thank you so much. And
yes.
We will see
and
you.
Thank you for the award. I really appreciate it too. So thank you. I'm not sure I deserve it, but I will accept it on behalf of the Bureau of Primary Healthcare. And again, just really appreciate the partnership. And really, to the people out there, I can't thank you all enough for everything that you've done. You have made such a huge difference with response to COVID, but really the work that you all have done and do every day is just so impressive and really is making a difference in children's lives and ultimately, their future. And so just can't thank you all enough for everything that you're doing. And we will continue to try to be a good partner. And if we have opportunities with funding, we will definitely, of course, be in touch with some webinars and other things. So just again, a huge thank you to Andrea and your entire team.
Thank you, Jim. Have everybody else have a great afternoon. And we look forward to seeing you at our next workshop at 3:45 p.m. Eastern Standard Time. Thank you all.
Thank you.